So Gia wants breasts, of course, or bigger breasts than she has already, so we're going to use implants. But because she wants a more natural shape, she doesn't want to look like she has implants, we're going to use a shaped implant. These are sort of anatomically shaped, teardrop, gummy bear. This is kind of the terms people use for them. So shaped implants in her case are better because they will look more natural. She doesn't have that much breast tissue to begin with, so this kind of has the shape of a natural breast, a whole breast. If you have breast tissue and you just want to augment it a little bit, often a round implant looks better. But in this case, since she has almost no breast tissue, a shaped implant, an implant will kind of create the shape of a natural breast with the implant itself. The shaped implant, for her, I think was a better choice for a number of reasons. One, they do look a little more natural because of their shape, but they're also a little firmer, which may not feel quite as nice, but definitely look better. They have a memory shape. The silicone itself actually is technically a solid, even though it's soft, and it has memory. If you cut it in half, you'd have two pieces, so you could literally put them back together. Nothing oozes out in any way. They're also textured, which decreases the risk of capsular contracture slightly, and you would think might cause rippling, but because of the memory gel, it actually has a decreased chance of rippling than the round implants. So in this case, it's kind of the best of both worlds. She gets the most natural shape. She gets a decreased chance of getting rippling. The only trade-off is they're a little firmer to the touch. Because Gia's transgender, there are a couple of things that are a little bit different. She may have a little bit tighter sort of capsule, or sort of the area where we have to try to expand. The skin there may be a little bit tighter, even though she has grown some breast tissue. The nipples themselves are often smaller in men, which, if we're going to use that as an access point where the incision will be made, it can be harder to get an implant through there.